The Mobile Integrated Healthcare Program is a program where I, the paramedic, visit patients at home, assess what's working, what's not working for the patient, and allow the other care providers to provide the best possible care for the patient and for the patient to understand what that care is and why it's in their best interest.
The difference I see in patients that are involved in the MIH program is they're getting their healthcare needs met in a far better place, and that's in their home, instead of having to come to the emergency department or be admitted to the hospital to take care of a problem that's spiraled out of control just due to the fact that they need some education and help figuring out how to take care of themselves.
It's a certain kind of backup for you, you know, without seeing a doctor or a nurse.
When I first saw Maggie, she was on oxygen, she was in a wheelchair, she needed assistance to get up and use the restroom. She was not necessarily feeling that hopeful about her recovery. And in just 2 visits, we were really able to change that around by giving her some strategies to deal with her feelings of helplessness and make her feel more in control.
It meant a lot to me that I knew that Wendy was coming and that she would be advising me on what to do and how to continue getting better. You know, you don't feel so much as a patient, but as a person. My life has changed. I can garden now, I can bend, I can stand up, I can walk, I can drive. You know, I can feed the animals, I can go shopping. So I've come a long way.
If MIH wasn't available to me, I would not be here today. I very, very much know that.
When I became involved with Valerie's care, her primary care was extremely frustrated with her non-compliance with her medications.
My quality of life before Wendy was nothing. I didn't do a whole lot of stuff. I didn't know how.
By working with her provider, and by getting to know her over a period of years, we have built a support team for her so that she now not only asks for help, she asks for help from the appropriate places and solves problems before they become a crisis.
She's very compassionate. She helped me to learn how to take my meds. If I have any questions, I can always get a hold of her. I'm very happy now.
This program is certainly not a replacement for primary care, and it's not a replacement for hospital care, but it is a way for those parts of the healthcare system to work together effectively. It's a way for a patient to come home from the hospital and still get the support that they need and be able to access the resources that they need to get better and get back to their regular life.
The mission is to carry on the healing ministry of Jesus Christ. And Jesus Christ didn't have an office where people came. He went out to where they were. And so, I think that's an excellent example of what the Mobile Integrated Health Program is doing.